Yeah, I'd like to know about thyroid. Can you actually tell about thyroid through a blood test? Years ago, you used to be able to swallow some kind of iodine solution, and then they had X-ray or something.
Okay. Well, thankfully, it's not years ago. Okay. Now, the way we test for thyroid function is actually a little bit more complicated in the way that it's generally done anyway, where you go into the doctor's office, they run something called a TSH, which is thyroid stimulating hormone. And if it's within a certain range, they tell you you're healthy. Well, the problem is that that's about the worst way that you can screen anybody for thyroid disease anyway. So generally speaking, when I screen people for thyroid disease, I'll do a TSH, but I'll do a T3, T4, ATG, and TPA. And what that does is it looks for the production, it looks for destruction, it looks for antibody, and it looks for stimulation, all of which are necessary for thyroid balance. But one other thing which most people don't know and don't bother to check for, and that's estrogen levels, because an inadequate estrogen level will lead to thyroid malfunction. It causes something called euthyroid sick. So if you're of a particular age where your estrogen level's in the tank, your thyroid's going to be screwed up whether you have thyroid hormone or not. So you have to treat the thyroid in conjunction with other control and command mechanisms, which include your gonads, it includes the pancreas, it includes basically your lipid tissue as well. So Anna, it's both simpler and more complicated than you would probably believe.